Assalamu alaikum. Peggy Muhammad here, and thank you for tuning in to Muhammad's Mosque number 48, Health and Human Services YouTube. Live right, think right, eat right, do right. When I did my very first presentation, it was full of mistakes, and I cannot abide that, so I'm doing it over again. The name of, please excuse me. The name of this program is Identifying Stress and Lowering the Risk of Stress-Associated Diseases, Ministry of Health and Human Services. I have a disclaimer. I am not a physician, nor am I a dietitian. I do not diagnose or treat any medical, surgical, psychiatric, or dietary condition. This presentation is for the purpose of education, which I hope will lead to an understanding of how stress affects our survival as individuals, families, communities, our connection to the Supreme Being, and how to reduce the risk of some diseases linked to stress. No content in this presentation should be a substitute for a direct medical advice from a physician or other qualified clinicians. The Supreme Wisdom lessons have more than one level of understanding. However, this lesson on stress will be extracted from a very basic level to help us make the connections between the Supreme Wisdom lessons and how to eat to live. There are different causes of some of the diseases we are about to discuss, and more than one benefit from eating one meal a day. However, stress is the subject, so we will discuss these conditions and benefits in relation to stress only. Excuse me again. Dry mouth. There are no photos in the Supreme Wisdom lessons, but I thought that it might give you some ambience of the time in which these lessons were presented, and that was in the 1930s. Problem number one comes from the Problem Book. The Problem Book by Prophet W.D. Farad, finder of the lost nation of Asia. This book teaches lost found nation of Islam a thorough knowledge of our miserable state of condition in a mathematical way. When we were found by our Savior, W.D. Farad. So we are the lost nation of Asia. This book teaches us about us. So what does it mean to be his own self? We'll determine that in a minute. Problem number two. The wife of Mr. W.D. Farad's uncle in the wilderness of North America weighs other than herself. Therefore, she has rheumatism, headaches, pain in all joints, and cannot walk up to the store. She is troubled frequently by high blood pressure and registers more than 32. Her pulse is nearly 80 times per minute, and she died at the age of 47. How many times did her pulse beat in 47 years? Could the ways other than herself mean that she's gained extra pounds? Or could it be what we call stress today? Could it be both? She's another aspect. Here is the second uncle, but the third aspect from problem number 6. The second uncle of Mr. W.D. Farad in the wilderness of North America lived other than himself, and therefore his blood pressure registers over 32. He had fever, chills, gripe, which is flu, hay fever, regular fever, rheumatism, and pain in all joints. He was disturbed by foot ailments and toothaches. His pulse beat more than 88 times per minute. Therefore, he goes to the doctor every day and gets medicine for every day in the year, one after each meal and 3 times a day, also at bedtime. Just who is this uncle, according to the supreme wisdom? The second uncle of Mr. W.D. Farrar, who lived in, who, once again, the second uncle of Mr. W.D. Farrar, who civilized the cavie when he used to live on the treetop and dug holes along the hillside for nearly 2,000 years. The exact time will be 4000 BC. Look into his eyes. Where is he looking? Maybe he's looking back to the past at what he used to be. I also see profound suffering. That's called ennui, and that's in French. Another aspect of us in the wilderness of North America. The third uncle was robbed of some atmosphere. What could this mean? Could this mean he has been living nearly 5 centuries with limited resources, limited access to nutritious food, limited adequate health care, limited proper education, limited safety and sustainable employment, or business, which are stressors that could lead to disease that threaten his survival? Limited, limited, limited. What is living other than self? Living other than self, besides the physical brutality, we were not living in our own name. We were living in the name of our slave masters. And so many of us still carry the last name of the slave master and his children who owned the slaves who were our antecedents. We don't have our own culture, our own holidays. We have Martin Luther King, and we have June 19th, but if you really think about it, who gets paid on those holidays? I remember we got Martin Luther King, a lot of people that didn't even like him got the day off, and I'm sure they enjoyed it. We were denied the knowledge of our own history. Well, we have our own history now, but there are others who are trying to deny us that history by learning it in public school. They want to deny it. They want to deny our learning it in public school. But that's all right. We've got enough churches and places where we can bring our children in on a Saturday and teach them our own history. So once again, we were denied that adequate education, nutrition, and shelter. There are more and more housed every day. How do we know who he is? Who is his own self? See English lesson number C1. Let's look what it says. What does it say? My name is W.F. Muhammad. I came to North America by myself. My uncle was brought over here by the trader 379 years ago. My uncle cannot talk his own language. He does not know that he is my uncle. He likes the devil because the devil gives him nothing. Why does he like the devil? Because the devil put fear in him when he was a little boy. Why does he fear now, since he is a big man? Because the devil taught him to eat the wrong food. Does that have anything to do with the above question number 10? Yes, sir. That makes him other than his own self. What is his own self? His own self is a righteous Muslim. There you have it. Definition of stress from the engineering a measure of internal forces in a material that changes its shape. From the old German, shape has become creation, so shape or creation. Middle English, it means hardship or the force exerted for the purpose of compulsion. Old French, narrowness or oppression. Don't have to explain about oppression. Medical, a state of worry or mental tension caused by a difficult situation, actual or perceived, feeling threatened or in danger, fight or flight response, or maybe freeze response. Chemical action occurs to help prevent injury. This is God-given, brothers and sisters. It's automatic. We don't have to plan for it. But we are not equipped to handle chronic stress without consequences. It's antithetical to human survival. The signs and symptoms of stress, easily agitated, overwhelmed, racing thoughts, one thought from the time you get up to the time you go to bed and not done it. Moody, uninterested in life, can't think about anything good in the future, depressed, apathetic, decreased sense of humor. That means you interpret everything literally, poor decision making, and inability to focus. Physically, low energy, tenseness, aches and pains, headaches, upset stomach, diarrhea, constipation. That sounds like a commercial. Nausea, insomnia, low sexual desire, ringing in the ears, dry mouth. That's what I have now. Hair loss. A lot of our sisters are losing their hair. Clenched jaw. Have you ever been awakened in the middle of the night, maybe 2 o'clock in the morning, and your jaws are tight, shut? Yeah. Clenched jaw, teeth grinding. Behavioral changes in appetite. You can be extremely hungry, which goes along with the stress response, or you can have really a loss of appetite. That's me. When I was in nursing school, I went down from 99 to 89 pounds. Very stressful. You can avoid responsibility, increase in alcohol, drug, and tobacco ingestion if you did it in the first place, nail biting, fidgeting, pacing. That makes me stressful to see someone do that. Here is our brother. He is stressed. He is vulnerable. He is experiencing a life event, a situation or external event that causes the stress response. These life events are called stressors. I wonder what his blood pressure is now. These stressors, financial, you can read them as I go along. We're not going to stay here for a very long time because you've experienced most of these. Financial, physical, psychological, social. Blackness is a crime many times. How about black while playing in the park by yourself with a toy gun? Policemen roll up on you in their car and shoot you dead. That to me sounds like murder. And it was a crime that young child got killed. Occupational, and there's just one thing that I want to call to your attention, and it's this idea of unequal pay. In some places of employment, you cannot even talk about how much someone else makes compared to what you make, even though you do the same job, even though you start at the same time, and even though you have good evaluations. Then there are life transitions from graduation, when you graduate from school, from college, or from high school, mainly from college. What is it that you're going to do? If you were Living with many people, now you're living alone, that's stressful. Or what about going from a wedding to a marriage? Those two are different. That's stressful. Pregnancy is stress on the body of the pregnant woman. Birth, adoption, divorce, that's stressful for everyone involved. And convalescent home placement, especially if you didn't think that you were going to live there. The stress response, excuse me, please, starts in the amygdala, detects things that are scary or dangerous in the environment. Then it goes to the hypothalamus. Then the hypothalamus wakes up the pituitary. Then the pituitary excretes the ACTH. And that's a hormone that can tell the adrenal gland to release cortisol. The adrenal gland is on top of each kidney. And the cortisol that comes from that adrenal gland, or the epinephrine that comes from that adrenal gland, travels through the blood and tells other body parts to react to stress. I have an amygdala story for you so that you get an idea of what the amygdala really does. It says, amygdala detects things that are scary or dangerous in the environment. I was 3 when this happened. My mother was in the kitchen cooking dinner. My father was napping on the couch. I was watching television. It was one of these grade B 1950s space movies. So the alien on this movie was trying to teach other aliens how they could bring humanity under submission just by thinking about it, just by mind to mind, mind to mind. So I was sitting there and I said, I'm going to do this. But I just had to have a chance. And then what happens? My mother says to me, Peggy, wake up your father. It's time to eat dinner. So I said, where's my chance? He was lying on the couch. In front of the couch is the coffee table. I got behind the coffee table and just looked at him. And I did what the alien said to do. But I did it silently. I did it in my mind. And I said, looked into my father's eyes, even though they were closed. Wake up, wake up, wake up. He didn't hear me, but he jumped up. He looked up, side to side, eyes big as saucers. My mother rushed out and she said, oh, you want to be careful about doing that. And then my father said, what were you doing? I said, I was just trying to wake you up without touching you. He said, well, don't ever do that again. That could be dangerous. I could have come up swinging. You see, my father had been in World War II. Today we call it PTSD. In those days, they called it something else. But he was very sensitive if you walked around him when he was asleep. But he never acted out like that. So that's what the amygdala does. It gives you a warning, even though you don't see where you are and see what's going on. It lets you know you have danger in your environment. Takotsubo cardiomyopathy is a mouthful, but Takotsubo means octopus pot, which is on the far right. Cardiomyopathy means cardio means heart. Myopathy means disease of the heart muscle. On the far left is the normal heart with visible apex. The apex is this part at the bottom. It's kind of pointy, and it's the ventricles. It's strong. It pumps. It's responsible for pumping action, pumping the blood around the circulation, around the entire body. But as I said, this on the far right is an octopus pot. But this in the middle is a heart that is shaped like an octopus pot. What's happening? So in Japan, where they eat octopus, one of the many countries that eat octopus, they catch them in these pots. And so it was in Japan where they started writing about Takotsubo cardiomyopathy. And so they named it for the octopus pot because when this heart was flooded with powerful chemicals, it looks like that. It changed to look like an octopus pot. And you see the ventricle is round, it's large. It doesn't have that pumping action. If you have to go to the emergency room, you will be going to the emergency room with chest pain and shortness of breath as though you had a heart attack. But once you get into the cardiac cath lab, there's a difference. In the heart attack, according to one doctor, he said a heart attack is a clot issue. But this cardiomyopathy, this Takotsubo cardiomyopathy, the coronary arteries are clear. And the patient can recover, although they must be under strict supervision. And you can see how strong these chemicals are to cause the shape of a normal heart to change. If you recall our definition of stress. When the Japanese began to write about it, they wrote about it in Japanese. So, and I believe this, from what I've been reading, it started around the 1980s, and then in the 1990s with Dr. Sato, the information was translated, began to be translated at that time. And it went to various places in the world, and those doctors at that time realized that they actually had experience with patients who had this condition. It is the result of an extremely stressful, emotional, or physical event. Most are women, so 80% are women, and 90% of those women are 55 and older. There you have it, a change in structure, powerful chemicals. What about the stress chemicals on the unborn? Before we talk about it, FOI, MGT, I want you to go to your computer or your telephone, whatever device you have, look up stress and pregnancy, how it affects an unborn child's brain. It's from Psychology Today. Do that for me. FOI and MGT. If the child in the womb is under the powerful chemicals of stress, this is what could happen. Massive destruction of the nerve cells. Negative effects on the hypothalamus, sleep and digestive problems. I've seen that several times. I want to go back to this massive destruction of the neurons, the nerve cells. I'm talking about the nerve cells in the brain and spinal cord. Those nerve cells have three parts. There's the basic cell called the neuron, and then there's the dendrites, these little, they look like tentacles, and in between the dendrites is a little space. That's where they communicate. So you will get massive destruction of those neurons or nerve cells, synapses, and dendrites. Negative effects on the amygdala, and we talked about that, and the hippocampus, which prevents information from entering these areas. Depletion of dopamine, lack of motivation and alertness. Depletion of serotonin negatively affects happiness and well-being. Depletion of oxytocin, that's the love hormone, as it goes down and something called vasopressin comes up. That condition is linked to aggressive behavior in a later age. Higher brain functions do not develop well. So the child may not be able to speak on time. In other words, they have delayed speech and delayed reading abilities. They could be at high risk for developing personality disorders. So FOI, MGT, when you finish reading the article about stress and pregnancy, I want you to read about personality disorders. Effects of chronic cortisol. In this case, the cortisol elevations. The purpose of cortisol is that it triggers the stress response, and in that it regulates blood sugar, it suppresses inflammation, it regulates metabolism, and it prepares you to start the day. Symptoms of high cortisol: weight gain, especially in the face and around the midsection, acne, thin skinning, slowed healing of the skin, muscle weakness, severe fatigue, irritability, difficulty concentrating, high blood pressure, and headaches. Excuse me once again. Chronic disease begins with insulin resistance, and we will be talking about how that happens. Diabetes, hypertension, cardiovascular disease, osteoporosis of weak bones, and psychosomatic disorder. Weak bones, not just in females, it's also in males. Mother of chronic disease, what does this mean? We're talking about insulin resistance. It's like a mother that spawns all these bad children. Insulin resistance. Let's talk about type 2 diabetes, from type 2 all the way to erectile dysfunction, because this is really not about type 1. So, pre-diabetes, type 2 diabetes, gestational diabetes. Gestational diabetes happens to women who become pregnant, and then they develop the diabetes while they're pregnant. And then when the baby is born, it usually goes away. Excuse me once again. Many people who are diabetic may also have tumors or cancer. Many cancer patients or tumor patients also have diabetes. You have coronary artery disease, hypertension, atherosclerosis. Maybe you get the stroke, the obesity, high cholesterol, fatty liver. You get fatty liver. It's very much like alcoholic liver, but it's not caused by alcohol. It's caused by sugar, especially high fructose corn sugar. Alzheimer's disease, which is the nickname, type 3 diabetes. Not every Alzheimer's patient has diabetes, but there is enough to make the connection. Neuropathy, if your diabetes is uncontrolled. Blindness, kidney failure, retinopathy, and of course, erectile dysfunction. I have the dry mouth. Excuse me. Metabolic syndrome, or insulin resistance syndrome, a cluster of conditions that increases your risk for heart disease, stroke, diabetes, and cancer. Affects almost 1/3 of the adult population in North America. Increases the risk for heart disease by almost 300%. So writes Dr. Jason Fung in his book, The Diabetes Code. That's another good read. Here are 1, 2, 3, 4, 5. Any 3 of these together equals metabolic syndrome. Then you need to have a talk with your doctor. Obesity. For men, waist greater than 40 inches. For women, waist greater than 35 inches. Blood pressure equal to or greater than 130/85, even though you are on medication. Elevated fasting blood glucose greater than 100. High triglycerides, and triglycerides are a common fat that's in your body. And when they're too high, that's another reason that you could have metabolic syndrome. Low HDL. If a man's HDL is lower than 40, not good. If a woman's HDL is lower than 50, not good. In this case, the higher the better. Any 3 of these. How to eat to live. Now that helps lower the risk of insulin resistance. Let's talk about it. Allow me to give you an instance. Sister or brother, you're in your 20s. You have a new business or a new job, and you work very hard and you work very well. And so when it's time for you to play, you play hard too. So you play a lot of basketball, a lot of volleyball, you run. If your diet isn't just right, you eat a lot of carbs, you keep that under control because you're running. And if we did a random screening, your blood sugar may be 80. And this continues until maybe you've been in employment for 10, 12 more years. Maybe you're higher up in the echelon. And so you have more stress, more responsibility. You're not as active as you were. And now you're eating more of the wrong kinds of foods. When you're 20, let's say you get a random blood sugar and it's 80. When you're 30, you get a random blood sugar and it's still 80, but you're not as active and you're eating worse. When you're, let's say in your late 40s, get another blood sugar random, it's all right, still 80. But what's happening here? Your pancreas is a rock star, and it knows that it needs to perform. So what it does, in order to keep your blood sugar level at 80 or 90 through your life, even though you are not as active and you eat worse or you eat more carbohydrates, then it has to pump more. And it does. It pumps more and more to keep it at 80. When you're 50, your blood sugar is now 126. The doctor says you're a diabetic. So what happened? In reality, it's been working for decades because your insulin has been working very hard. It's been your insulin is working hard because your pancreas is working hard. It is secreting a lot more insulin just to keep it at the level when you were 20 and doing well. That's what happens. So the lingering stress response leads to elevated levels of cortisol. Over time, it can disrupt the body's glucose metabolism by increasing inflammation, which in turn increases blood sugar levels and promotes insulin resistance. The chronic stress response also increases appetite and stress eating. The food is readily available. It's easy. It's in the freezer. It's in the lower part, and it's in the cupboard. Generally, it's high fat, high carbohydrate, and highly comforting. No one craves broccoli. Insulin resistance is then when the blood glucose remains high despite normal to high levels of insulin production. If you are constantly eating, you are triggering insulin production all day long. Too much insulin causes the cells to resist insulin. Yep, that's what happens. I want to tell you the difference here between type 1 diabetes and type 2. Type 1, you don't have enough insulin, so you have to have insulin shots. Type 2 diabetes is you have too much insulin in your blood because you have a rock star for pancreas. Okay. So how to eat to live is really should be called, I believe, our corrected way of eating. We just call it How to Eat to Live, and it's really a book in 2 volumes. First volume in 1967, second volume in 1972. So it describes how we're supposed to eat in order for us to increase our longevity. And it's our body of knowledge. We don't get it from anybody else. Those that should not do 1 meal a day are women who are pregnant, women who are nursing their babies, any child under the age of 16, and any adult, anyone who is recovering from an illness. You need to eat more than once a day in those cases. Now, how does How to Eat to Live do this? Well, because we eat one meal a day, the insulin goes up once, then it comes down. Because you are not triggering insulin production all day long. How does this work? According to the Most Honorable Elijah Muhammad, he said a good time is between 4 and 6. And traditionally, if we've been instructed to eat for 2 hours. So you've got 4 to 6. You start at 4, you have a 2-hour window to eat. At 6, drop down, stop eating, nothing to eat between 6 and 4 o'clock the next day. Can you have water? Yes. Can you have a snack? No. Can you have coffee? Yes. But it's better to have it without sugar, especially if you are diabetic. So no snacking between meals, no sugar, no starchy foods, no bee crop if you're diabetic, no bread, no corn, no rice, no oats, no pasta, no potatoes. No, no, no. It's just like in that movie, the Book of Clarence, the Virgin Mary says, I'm un. So no processed foods or seed oils, no alcohol, tobacco, or other harmful drugs. The tobacco has nicotine and it decreases your insulin sensitivity. The most beneficial foods are the ones that are raised and prepared ourselves. And some of the best foods are navy beans, which only Master Farad Muhammad recommended for us because it has such a good nutritional, it has good nutritional value. It has, oh gosh, it has a lot of vitamins. It has vitamins and minerals. It has everything that you, not totally everything, but mostly. And whatever you can't get in the navy bean, you can get with other foods as long as they are good foods, and you should really prepare them yourself, such as vegetables that are cooked or steamed, fruit eaten raw, whole wheat bread. If you have difficulty with wheat, don't eat it. Pure whole milk. If you have difficulty drinking milk, don't drink it. You don't want that to happen just because you're trying to drink some whole milk. But other milks, so-called plant milks, don't equal whole milk, okay? Drink pure water, as pure as you can. Butter is good. Eggs are good too. One thing about eggs, it has very little bit of saturated fat. Mostly it's unsaturated fat. Now that concludes my presentation. And maybe one day I will be doing another presentation so that we can talk more and more about how to eat. But wait, before I go, just one moment. Okay, what's going on? Oh, I need to stop the share. Haha, there we are. So before I go, allow me to say the motto. This is going to be what I'm known for when I sign off. Okay. Live right, think right, eat right, do right. Assalamu alaikum.